Good morning. We'll call
Morning.
the Kennesaw County Health and Human Services meeting to order. And our first order of business is to adopt the minutes from the previous meeting. You received them in your packet.
Mr. Chair, I'll move that we adopt the minutes.
Commissioner Nissen moves on the minutes. Do I hear a second?
I'll second that.
Commissioner Anderson seconds. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. All right, then we can move right on to we have no warrants or anything to cover, so we'll move right on to the best part of the program. And we have Rochelle here from Pact for Families Collaborative, so welcome and come on up.
Thank you for having me. This is good because we'd like to try to do an update every year, and we have a lot to share, actually. So 2021 was very busy, as everyone.
Excuse me, for the record and for those watching, would you state your name and
Where I am.
who you represent? And you're welcome to take your face covering off if you
Okay.
wish while you
Then
present.
I don't have to fog my glasses.
Yeah.
So my name is Rochelle Peterson. I am the Executive Director at Pact for Families Collaborative. So I thought I would just do a little bit of update kind of our year and just some projects we're doing, and then looking forward a little bit of what we have in store. So 2021, like everybody, was a busy year trying to manage COVID. But the one thing as a summary of what we do, kind of the elevator speech, is Pact for Families is a joint powers agreement, as you know, with our 5 counties and our neighboring areas. And we really try to fill in the gaps. There's a lot of things that counties can do and programs can do, but as a collective 5 counties, we try to fill in the gaps of things that are maybe missing or just the resources aren't there. So we go out and try to find those missing pieces and find the resources to help support kids and families in our communities. So late in 2020, we received word that we received several federal grants, and we wrote those grants right before the onset of COVID, then found out kind of mid-COVID in that beginning year that we received those. So we were really busy trying to create and hire people. And so I just want to tell you a little bit about those 2 grants that are really important. One is called the Journey to Independence, and that was a program that even started before I came here 6 years ago, that transition age youth in our communities fall through the cracks. So kids with mental health concerns that are aging from the children's mental health system and they age into adulthood, they often fall through the cracks and they end up in our criminal justice system. They end up in other systems and don't know how to navigate. So this is something that our board had been working with the legislature to try to create something that could be a rural demonstration project, because we know out here the resources can be fewer than in an urban area. So we brought that to the legislature. They always loved it, but they said, maybe you could get some funding and just get us some data and show us how this more would work. So that's what we did, and we applied for a federal grant. And so in the last year, we've been really getting that going and up to speed. So that is something that we're doing for a 4-year grant. So we have about 2 3/4 years left of that, and we're really doing a good job of gathering data and showing kind of where the gaps exist and where the need lies. But we will be reaching out to the legislature again after we're starting to end that grant and asking for a little bit of funding to continue, because we know it's really hard to show impact in 3 years. But if we could get an additional years. But I share that because the whole idea is to create a sustainability plan. What are the pieces that are most needed in our community and move those forward and to show that. So you might be hearing more about that in the next few years. I also wanted to talk about our Partnership for Success funding, and that is a 5-year grant that we received with Candido County, Renville County, and Yellow Medicine County. It's with PACT, but we covered those 3. So we work in public health. You've heard a little bit of updates from Annie Tepfer with that grant, and so we are in that same process, a little over a year into that grant, but that's a 5-year program. The same thing, we're trying to find out with prevention efforts when it comes to substance use and abuse, what are the most crucial parts that need to exist to keep prevention efforts alive and drug use down among young people. And Yellow Medicine is an interesting partner in this because their funding went away at one point for a few years, and they saw increases within those few years. They saw increases on paper and in their communities. And so it really shows you that prevention efforts do work, and they need to sustain it at a certain level in order to be impactful. You can't just drop off the radar and go away and expect years of work that you've done previously just to sustain itself. So what level of prevention efforts do we need to maintain good stats in our communities? So those two I just wanted to highlight because those are really things that we're going to talk about. I mean, federal funding doesn't last forever, and we've been very fortunate in Candida County to have prevention dollars, but they're going away. So how do we sustain on the level we need to? And what is that level we need to sustain? Connecting Families is a program that we took over from West Central Industries when they sunsetted, and we've changed the name. They had a different name, but we really at PACT, I say oftentimes our systems, we don't do a good job of, we give resources and then we walk away and then we expect folks to kind of figure it out. So our Connecting Families program is one that we really are trying to walk alongside families, support them, but connect them together to be that informal support that's often missing for families that are struggling. And that, I'm very proud to say, has just been very successful. We're really building a network of families that are coming together and understanding each other and working collectively together. So we've just done a variety of things. We've done some sensory-friendly movies for families that have children that struggle, where they don't feel like they can have outings. So we've partnered in Hutchinson. We're hoping now to create some of these movies here in Wilmer, but the State Theater in Hutchinson opens up certain times. We're doing 6 times a year where the lights aren't quite as dark and kids can move around in the theater. Nobody's going to judge them. It's all open for families to come together, and they're connecting, they're meeting one another, they're sharing resources. So we're building those informal supports. So our LAC, which is our local advisory committee, so our 5 counties all come together after our collaborative meetings and come together. So I just wanted to share because that is one of the things that we need to share with you as the county board is what is our local advisory committee doing? And I wanted to share this positive messaging that we did in May is Mental Health Month, and we shared these out with restaurants, with businesses, with schools. We emailed them to all our partners, and I did hear they were spreading because certain people I wouldn't even know of said they ran across one. But it was resources, it was conversation starters for families about, what did a friend do today to help you after COVID? I can't wait to, who do you talk to when you're having a hard day? These are things that kids and families could do together. Very simple, very easy, but this is one thing that our LAC did and got it across all 5 of our counties. So I have copies of these, and it went way beyond May is Mental Health Month. They were just positive messages that went out. The one thing that we're looking at really in 2021 and into 2022 is equity and trauma informed. And so one thing I just wanted to share is that we have been receiving grant dollars locally to train people to be trauma responsive in our communities. And one thing we're doing actually next week for our collaborative meeting is we are hosting the University of Minnesota, the Tribal Training and Certificate Partnership to Understanding Historical Impacts and Contemporary Trauma in American Indian Communities. I attended a 2-day training. This is only going to be 1 day last year, but it was very impactful, and it really gives an understanding of ICWA and how that came about, and how actually historically how ICWA was created and how that really created our modern day child welfare system. And it gives, I think, a lot of answers. And I think some of the feedback we heard from social workers that were on that is, we know we have to follow ICWA standards. We know there's boxes to check and things we're supposed to do, but we don't always know why. How did this happen? Why did it happen? And I think it creates a greater understanding, and I think it gives a really good platform about when we're working with marginalized families. It doesn't matter if they're Native folks. And so we are sponsoring this next week for folks who want to train, and we're giving CEUs. And it's one of the nice things that we can do as an agency is we hopefully provide free or reduced price trainings for people that are needed in our communities. Then in April is our BRAIN conference. Those of you may have heard of that, and you're always welcome to attend. But this year is Community Equity, Voices Shared, Voices Heard. And our keynote speaker is a professor from Bemidji State University, but he's internationally known for his work. His father was a German Holocaust survivor, and his mother was Native American, so he has a very interesting personal viewpoint on equity. And but our breakout sessions are going to be just talking about other communities, mental health, people and different that are struggling with addiction, disabilities and things. So we're really having an opportunity to talk about equity in our communities and what it means and how we can do better. So that is looking forward in our very near future, but I also wanted to talk about our calendars. And I don't know if anybody has seen these, but we had partnered with Public Health, Renville County and Candia County Public Health. We've had a group going for about a year and a half on ACEs projects, and we've just come together, and this was a long project in the making, but it's getting a lot of coverage right now. We've had a lot of people reaching out where they're finding them, and I brought enough for if people want them, but it is really talking about ACEs and adverse childhood experiences and how it impacts kids and families, but this has a positive message about, again, conversation starters, resources, how do you manage ACEs and what are they? So to kind of circle back to the beginning, we fill in gaps. I think we're doing a great job of just supporting kids and families and trying to do positive messaging, be informational, give people resources that they don't always have in our community. And my end goal, like I always said, is sustainability. I know I've been around a long time and worked a lot in grants over my career, and funding isn't always there. So we have to create a plan to help communities be healthy and support themselves and not be dependent on dollars that just ebb and flow into our communities. So that is my update.
Thank you. Jenny.
Say, Rochelle, would you speak about the Aaliyah training that you guys are sponsoring? Because I think that that's very beneficial.
It is, and I have it on here, yes. One other thing, I actually had 2 of our social service directors come and 1 supervisor about over a year ago come to me and say, things are changing drastically and it's really hard. We got a lot of new staff, we got a lot of new changes. How do we weather kind of the old way of doing things, the new way of doing things, mandates, things we're required to do? And it was interesting because it all was within the same month that I was getting these requests. And I was given some information on a UCare grant about making changes, healthy changes in communities. And we applied for a grant and are partnering currently and just starting with Aaliyah. It's a group. A woman who started it is from Minnesota, but she's recognized nationally. In fact, I think People named her as one of the most powerful or influential women a couple years ago in our country. But the Aaliyah group talks about moving change and how to move change. And that's the thing, making change is a full-time job, and trying to do that and to support our directors. And so the directors of social services and some of our public health directors in our 5-county area are meeting monthly with Aaliyah. We did 2 breakthrough days to just talk about what are your wishes, what do you hope for your departments, and they're going to walk through a whole year process. It's not a one and done training. It's coming back every month, talking about your challenges, how to move through those, and then collectively, I think what's nice and the feedback I think we heard in those first couple days is you're not on the island by yourself. There's other directors, there's other supervisors you can lean on and talk about the struggles that you're doing and how to move forward. And Jenny is part of that group. And so I think it was pretty positive. So
Mr. Chair, can I?
Go ahead.
Oh, yeah, so we get a lot of acronyms and stuff. What does Aaliyah stand for?
it is actually, that's just her name.
It's her name,
Her,
okay.
well, her
It's
name
not-
is Amelia,
All right.
Amelia. So, yeah, so Aaliyah
All
is
right,
part of
no,
that. It's not really an acronym.
I
Aaliyah
want to
is-
thank my friend for being the one to ask that question.
And then does PACT stand for anything, or is it just PACT?
Putting all communities together.
Okay.
So, and then that historical perspective is years ago it was 4, so it was the number, so oftentimes people will see the number 4 because it was 4 counties, and then at the end of 2012, a 5th county, McLeod, joined, so now it's PACT, FOR,
Okay.
family.
And so how, you said 5 counties. What are they? There's Canuay, Renville, Yellow Medicine, and
Save some
McLeod.
questions for us, Commissioner.
What's the last one?
Meeker,
Beaker, okay. Thank you.
yep.
That was my question. Commissioner Bird.
Thank you. Would you elaborate a little bit more on the history of PAC-4?
Well, I mean, it's been over 20 years, almost about 25, 1993. There were many counties that were invited to the table, and Corky can probably fill in more than me.
You're fine.
And originally, then those 4 were the ones that worked through the process and said, yes, I want to be a part of PAC for Families. And collaboratives were created by the legislature in a way to really just combine resources and hopefully leverage more dollars to make impact in the community. So it is bound by legislative action. People will ask, well, if anybody can just ask for dollars, and, you do have to be a partner, and that is part of, people think I'm being kind of snarky when I say, no, you have to be a partner, but truly that is legislative requirements, that you have to be a partner in and be committed to in whatever capacity that is, by either dollars committed to or in-kind support.
Thank you.
So,
Go ahead.
Mr. Chair, I'd just like to add that over the years, PAC-4 has been, has used very little county dollars in providing these services and filling these gaps, and it's so unique back then. There were so many silos, and we still have them, I guess, when I talk about silos. Human Services, Canuay County did their thing, Renville did their things, and this is the first time that when they used the legislative term collaborative, up to then, most people have talked about partnerships. And you do something collaboratively, you take it to a whole different level of working together, and really change how things happen throughout the state, but especially in our region, because a lot of the counties did not go together with 4 or 5 other counties, and were unique, which made us really special, I think, in our collaborative, that as a group of counties, we went together and looked at different ways to fill the gaps, and were very successful. PAC-4 has been in grants. How many millions would you guess
over time or current?
over time?
Oh, 40, 50 million.
Into our region as a result of that and providing the services. And I think it's been very effective, and it's good for the economy as well. And it makes us stand out in the state.
We are the largest geographic collaborative in the state. Which presents its challenges too. We start from Glencoe and go to the South Dakota border. There's a lot of differences in needs in those communities. So collectively, but separately, it's unique.
Yeah.
Other questions or comments? Well, then I would thank you for coming in and presenting your information. So,
I'm going to leave these for you, the calendars and the positive messaging, so you can see those. and they don't go out of date, so. That.
All right, so this next discussion is going to be about the Human Services Committee and maybe where we might be going forward with that, with the committee meeting.
So good morning, Jenny Lippert, Health and Human Services Director. This morning, I'm just requesting that we have a discussion about the future and continuation of the Health and Human Service Committee meetings. I want to start out by saying I'm not looking for any type of a decision to be made today, just to have some conversation around these meetings. We have done a lot of evaluating internally about these meetings throughout our leadership team, and we've tried to look at ways that we could get you all the necessary information that you need about what's going on with Health and Human Services and the agency, and keep you up to date on everything, but also looking at making these meetings a good use of your time, our staff's time, and the overall general public's time. So I first approached Administrator Kleindl about this and just was trying to brainstorm, are there any ways that we can streamline these meetings to, again, have less administrative burden, to have maybe some areas that are not as redundant as they have seemed to be in the last couple of years. And then more recently, Administrator Kleindl and myself had met with Commissioner Berg and Commissioner Imdick and had future conversations about thoughts and ideas that we were looking at internally. So what we kind of are looking at is not having a set schedule for the Health and Human Service Committee meetings. So what that would mean is that myself, I would get on the regular board slot agenda like all the other departments do. The agency would still bring forward our annual reports. We would still bring forward any necessary contracts that maybe are new or have significant changes that wouldn't apply to the consolidated new format. And then any other prevalent information throughout the year. We would get on the board slot and make sure that we bring all of that information forward. The benefit of doing that is that it would allow us to also be able to potentially utilize some work sessions. So oftentimes what happens is if we have a lot of information to cover or a topic that is very in-depth, we can't get through all of the information in our 45-minute time slot for the bi-monthly Health and Human Service Committee meetings. So this would give us the opportunity to also, instead of just having the bi-monthly meetings, we could schedule work sessions that could go longer and we could have a more robust conversation about those items, on top of still being able to present for you whatever that looks like in terms of requesting board slots on the regular Tuesday board agendas. What often happens as we plan for our year of our bi-monthly Health and Human Service Committee meetings is we're often trying to scramble sometimes last minute to find outside providers to come in and speak to you because we just don't have enough relevant information to provide you with all of those meetings throughout the year. And many of you sit on those committees or boards themselves, so you automatically usually give an update at your end of the commissioner time when you give your committee reports. So I don't know, Administrator Kleindl, if you've got some other comments about this discussion.
Yes, go ahead. Administrator Kleindl.
Mr. Chair, as you recall, a few years back, we started adding community corrections to this year committee along with veteran services. Again, that was intentful in that we wanted to have community corrections to have their opportunity to be able to present stuff in front of you. But also is to make better use of the time. So if the board would at least want to try this, we would still do community corrections, still have updates, and we still would have veteran service updates. But oftentimes, even when in talking to Tammy Jo, you know, when it's their time coming up, they're trying to find something, and oftentimes they're busy trying to do their day-to-day operations, or Tammy Jo is also now the state chair in a lot more other committees. And so she's trying to make things to present And even though it's important, it still takes staff time to do that. And so what I would ask is that at least take some time. We're not asking for a decision today, but what we would like to do is paint that picture that you're not losing anything. It's just going to be how we present is going to be differently. My thought, Mr. Chair, is that we would still start our meetings at 9 o'clock, and our board meetings may be done, by 9 or by 10:30, 11, but there'll be times they'll go just like we do now. I also see it as an opportunity for other departments to have an opportunity to get in front of you. Oftentimes, the board meetings ebb and flow. Some board meetings, we have very little in-depth conversations, but a lot of presentations. And so, and then on other board meetings, we have department heads that would like to get on, but because we have so many things on the agenda, we say, come back next time. Well, next time, oftentimes what's been happening, it doesn't take place. And so my intent is to try to make this more intentful and maybe have times where other departments would be assigned, this is your month, can you give an update to the board what's taking place? I'll use passports for example. We took passports back several years ago, and just how the operations have gone, even with COVID and all the things we had to adjust. We know that, but we haven't had an opportunity to have you guys know that, or the public to know that. So Jenny and I, as she stated, we met with Mr. Emdike and Mr. Berg, and we showed them a half a dozen other counties' agendas and how the board agendas were set up, and shown, they still have family services or community corrections on there. And you would still do your contracts, just like you do now. It'd still be presented to the board. They'd probably be more as a consent agenda type thing on some of those things that are renewal. But if there are something that's changed or something, they would present just like do now. I'd open up for questions.
Thank you. I'm sure there are a couple questions, but before we go to the questions, I'd ask if Commissioner Berg has any comments regarding the conversation that we had prior to meeting.
Mr. Kleindl, I think you summarized that really quite well, our conversation. And I think we are looking at from the point of view of the whole board, the best use of the board's time to be able to fill in those gaps. And of course, I'm very biased to human services and corrections and an opportunity to be in front of the board on a regular basis like that. But we also have to look at, we've been having very long board meetings, and in some areas there's big gaps in. And it's, I think this would make a better use of the board's time and knowledge for the board, a very broad look at this. I also want to point out, as you were talking about it, let's just try it out and see how it would work.
Thank you, Commissioner Berg. And Ms. Lopatka and Karen Dahlman were also part of the conversation, and because there were some logistics that we had to be concerned about, making sure we got the bills paid and the minutes and all that. And they were also supportive of going this direction, as am I. I think one of the things that we'll be able to do perhaps is spend a little bit more time on issues that in the past, sometimes we had to act on them rather quickly. So now we might be able to have a conversation. And I'm not talking about just health and human service issues, but county issues overall. I used the example the other day, I think, of the Wilmer Y project. I believe we were introduced to it and asked to make a decision in the very same meeting, which is very difficult to do at times. And so this will give us a chance to be thoughtful about some of the proposals that come in front of us, discuss them, go back home, think about them some more, and then act on them at a later date. So any other comments or questions from the rest of the board? So Go ahead, Ms. Lippert.
I would make a recommendation if possible. You know, we are trying to plan for this 2022 year. We oftentimes are looking at the schedules, trying to contact providers. I'm contacting our internal staff about giving reports. So if possible, you guys as commissioners and the board could make a decision by the next board meeting or something within that time frame would just be a suggestion I would have to make. So we know kind of the direction and what stuff we need to do to plan for this next year.
I think that makes sense, and here's an example of how we're not gonna act today. We're going to go home and think about this and make sure that, at a future meeting, we're prepared to have the discussion that will lead to, board action. So if I don't hear any other
I
comments, go ahead.
I'm just going to make a comment or two. I get the general gist of what you're referring to, but Dwayne and I and Steve have not seen the items that you and Corky looked at. I don't know what's there or what isn't there. And so at this point, you're more informed than we are. I don't disagree that it might work out better and more smoothly, and maybe I've never had a problem with the length of the meetings actually, because pretty good pay for a part-time job, somebody once told me, but but it isn't a part-time job. They don't know that either. But that's my comment. I just don't know if I have all of the information that you were showing, like the counties, for example, that and the layout of how they do it. So that would be helpful.
Sure.
And that's a good observation and information, and that's the very reason why I advocate for not making a decision on the day you're introduced to something, because you may have other questions that arise between now and when we make a decision, and if we're not ready to make a decision at the next meeting, we'll have 2 meetings in March. So we can do this, answer the questions. If we're not ready to make a motion at the very next meeting, we can do it at the following one. But, and I'm sure Jenny can, it wasn't much more than what was presented today, to be honest with you.
Okay.
Go ahead. I don't remember the details.
Mr. Chair, just for a little history too, so when Mr. Berg was the Family Service Director, after he retired, we had discussed about doing away with this committee and doing this. In 2006, when I became the administrator, this topic again came up about combining it to, so it's something that we have talked about and had discussions and looked at several different times. And we just, things were a little different there, how the committee structure was and stuff and what the intent was. But this has been something we've had conversations for a couple of decades on.
Commissioner Gardner.
Thank you, Mr. Chair. I suspect that part of the continued conversation might revolve around whether or not we actually need to disband the committee, or we just simply keep it on an as-needed basis. Overall, I think what we're talking about sounds reasonable. I'm not opposed to having more information before we make that decision.
Mr. Chair, thank you. And when we have talked about this, we looked at other options as well. Maybe just the first meeting each month, we would have the Human Services meeting at 9 o'clock to 10, where we also talked about doing it quarterly or different ways of doing it. And it seemed like the simplest and the most logical way is to just make it one big board meeting we have, like we've been talking about. So we have explored those, but you haven't had a chance to explore those and talk about that, and that's what we can do next time, I'm thinking.
It's good to know I'm sorry, Mr. Chair.
Go ahead.
It's good to know what information you would like to have. And so I appreciate you saying, we'd like to see so thank you for asking that.
Yep.
Go ahead.
Mr. Chair, may I just point out to the public, because of the open meeting law, that's why the chair and the vice chair are meeting and have more information than the rest of the commissioners. And unfortunately, we have to follow those rules and regulations and put it out on the table now, and that's what we're doing. So.
And I just have
Commissioner
one
Anderson.
kind of a comment or question, I don't know really which, but I think part of this would be in future meetings, we wouldn't have to just limit it to the 1 hour. We could go into the next hour if we have to. And then also, I think you said that if we needed to, we could do workshops. So it isn't really getting rid of this committee. It's almost, in some ways you could look at it, it could be expanding.
Right.
So,
As well as other departments like Tammy Jo's department or Mel with Public Works, we have a road and bridge meeting, but even that could be potentially changed to 2 or 1 meeting and, information at other meetings. So go, Ms. Lippert.
Just to follow up with what Commissioner Anderson said, so just this last year, one situation that you all would maybe be aware of is I had our supervisor, Corinne Torkelson of Mental Health, right? She was here to give you an annual report update. There's been a lot of changes at the state with the SUD and comprehensive assessments and just the caseloads of mental health, both adults and children. And it took us 3, if not 4, different piecemealing of time slots throughout the HHS committee meetings for her to have to get cut off and then remember where she was to come back and to present to you. So that's just an example of a way that we could streamline that. We know there's a lot of information. We know that there's been a lot of changes with mental health here locally and at the state level. So we could at that time then have requested a work session to then give us an hour, give us an hour and a half, give us 2 hours, whatever that would look like, where you guys could get all of the information at once versus trying to remember what things were talked about last time versus questions for next time.
Thank you. Well, this has been a good conversation already, and
Yeah.
fellow board members, go home. We'll think about this some more, and hopefully we'll come up with some more questions and Ms. Lippert has got one more thing or maybe a couple more things you want to share with us?
I do. I just want to, as long as I'm here, I want the public to know that on this Thursday, February 3rd, Public Health received 5,000 KN95 masks to distribute to the public. And so we will be holding a drive-through distribution event where we will be able to give out 3 KN95 masks per person, or as many as you would need, up to 20 per your household. This event will be held from 3 p.m. to 6 p.m. at the Candy Ojai County Rescue Squad building. This is the same location that we used for all of our vaccination events. It's very smooth and quick and an easy access for folks if you're out and about and you're needing the masks. So again, the KN95 masks are offer a little bit more protection from the current COVID variants that are out there, but they are open for, again, anyone throughout the public. They're free, adults only, however. So encourage everyone to come out and get your masks and get masks for your family.
Thank you for that reminder, Administrator Clark.
Jenny, can you also say that those masks are reusable and how you can reuse them? Because this way they can go further.
Sure, yep. So we're able to give 3 per person, and how these masks should be used is that you can use them for a day or for a time period that you need to wear a mask when you're out in public, and then you can save it. They really talk about putting it in a brown paper bag. It kind of takes the moisture out of it and kind of self-absorbs and cleans the mask, and then use your secondary or third mask and rotate them through every use. So unless it would get visibly soiled or if the ear loops start to become loose, then you should dispose of the mask, but otherwise you can reuse these KN95 masks. They're not like a disposable surgical mask.
And they are not recommended to be washed.
And they are not. Thank you for that. Nope. They're not recommended to be washed. If you do get them soiled, they do need to be thrown away.
So once this immediate distribution takes place, and we do need to replace them, we need a new supply of them, how will we go about that? Is that, then are they expected to be available at the pharmacies and maybe more in the public?
Yes, so we are being told that different pharmacies throughout the state and locally will be receiving shipments as well, not just us at Public Health. So I would assume that we will be seeing some information coming from the pharmacies. Also, schools and childcare facilities are supposed to be getting shipments as well. But I would say, we're not hearing that we're going to be getting another shipment. If we do, we will make sure that we publicize that just like we did for this event. But otherwise, I would tell folks they're still available online. You can try to purchase them on your own.
Thank you very much. I will call this meeting to an end, and we will adjourn as the Kennewick County Health and Human Services Committee.